Hello. Hello again, and thank you for joining us today. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'm returning as your moderator for today's Faculty Town Hall. I will note at the start that we have a technical glitch that the closed captioning is coming from a history class. So please bear with us on that matter. But today we have a group of panelists to provide some updates on vaccine distribution, our operations during the COVID-19 pandemic, and to answer your questions. As before, a number of you have submitted questions during registration. And please feel free to use the Q&A window in the Zoom application to submit additional questions for our panelists. Due to time limitations, we will not be able to get to all the questions today, but we will log them and as they come in and post the answers on our Return to Learn website, which will be inserted into the chat, returntolearn.ucsd.edu. The webinar does have live closed captioning available, but I think there may be some technical difficulties with that. We're working on that. First you click on the closed caption button at the bottom of the screen and select Show Subtitles, or there's also going to be a link inserted. But like I said, there may be a technical difficulty with the closed captioning today. But now, with no further ado, I'd like to introduce our Chancellor, Pradeep Khosla, for some welcoming remarks. Chancellor Khosla.
Thank you, ABC Continetti. Good morning, everybody, and welcome. Welcome to this faculty webinar. As you can probably tell, our winter quarter is going really well. UC San Diego continues to serve as a leading example for other universities at this stage of the pandemic. After an expected uptick in the positive cases in early January, which is when the students returned from home, we are back to the same low levels of cases on campus that we saw throughout the fall quarter. In fact, if you look at the recent last week or two of data, we are even less than what we were at the peak of the pandemic back in the fall. Our faculty, our staff, our students have all been very, very instrumental to our success. I know this hasn't been easy. I think everybody is pretty stressed out and people are eager to come back. And just about every one of us that I have talked to is experiencing pandemic fatigue. So in order to manage that, I urge you to take advantage of the many resources we have available to help if you're struggling. So as we speak right now, the big question on everyone's mind is, what about the vaccines? When are we going to get vaccinated? So there are multiple people on the agenda today who are going to tell you about what we're going to be doing and when. At the highest levels, let me tell you, we at UC San Diego and San Diego Health partnered with San Diego County and built this Petco Park super site to deliver 5,000 vaccines a day. We were doing really well until we ran out of supply of vaccines. And we are right now managing, as we get the supply, we keep on delivering the vaccines. We also opened our REMAC facility, which is where most likely most of us on this campus will be vaccinated. And again, that has a capacity of about 2,000 a day. So overall, the whole campus is playing a very strong leadership role in the community, in keeping the community safe through delivering the vaccines. Let me end by sharing one more piece of good news. If you have been watching the news, yesterday, Governor Newsom, Speaker Anthony Rendon, and Pro Tem Tony Atkins announced a relief package for Californians. There are many aspects of the relief package, including reliefs to individuals, families, businesses, it goes on and on. But the most interesting part for me as Chancellor was at the very bottom, which was titled Restoration of Reductions. And this is what it said. The agreement restores previously enacted reductions effective July 1st, and I assume July 1st of 2021, for the University of California, Cal State University, the Judicial Branch, Child Support Services, and for moderate income housing. So assuming this is true and it holds, I'm expecting come July 1, 2021, which is the end of this academic year, we would have the same state budget as we had on July 1, 2019. Remember July 1, 2020, we would have gotten an increase, which is not mentioned out here. So we would be 2 years behind, but nonetheless, way better than what we think we are right now. And this gives me a great deal of hope. This restoration combined with hopefully the enrollments we're going to see in come fall 2021, I think we should be back on track to build this campus the way we were building before. So there are several things that might happen. The first thing I think we're going to do is take a fresh look at the 3-year faculty hiring plan. And I can guarantee you very soon we'll be announcing something in making investments for making our faculty stronger and going back to a 3-year hiring plan. So the departments and the chairs and the deans should be thinking about this. But this is all based on our hope. Secondly, I think this is a chance to rethink as to how we allocate any new resources. Is there a way to rethink what we've been doing in terms of graduate support? And the list goes on, but we do need to rethink. Thirdly, there's a little piece of kind of bad news. When we get this restoration, there's also serious talk amongst the chancellors and the president about rebenching, and rebenching, a complicated story, tries to make sure that all campuses receive nearly the same amount per student. And in this rebenching, we at UC San Diego stand the potential to lose about $8 million. So we will have to absorb that. But overall, I can tell you, I went to sleep last night thinking very positively about where we are as a campus. I wake up more optimistic, and I hope you share my optimism, and let's all work together to find the new beginning come the new budget year. So thank you very much, and back to you, sir. Bob?
Thank you, Chancellor Khosla. We all appreciate those elements of good news. Now I would like to move to welcome the host of today's town hall, UC San Diego Executive Vice Chancellor Elizabeth Simmons. Elizabeth.
Thanks very much, Bob. It's a great pleasure to join you in welcoming everybody to today's town hall, as we'll hear the latest developments on campus operations, planning for future quarters, vaccines, spring break. I would just like to briefly reiterate our deep appreciation for the ongoing support that the faculty have given to one another, to their staff colleagues, and to our students above all. Your adaptability, your compassion, your dedication and flexibility has been essential to keeping the Triton community strong in this unbelievably difficult time. And with this, I'm just going to turn to my colleague, Dr. Stephen Constable, the chair of the Academic Senate, for his remarks.
Thank you, Elizabeth, and welcome everybody. I'm really quite happy to say that the COVID situation is looking a lot better than the last time we met. The vaccine rollout has stabilized and the community case rate has fallen steadily and significantly since the beginning of January. However, we must not let our guard down, and I urge you to continue to mask and distance. If you're coming to campus, even occasionally, you should continue to conduct the daily symptom screening and weekly COVID tests, regardless of vaccination status. And I'm sure you're going to hear more about this later. By the way, if you're using the vending machines for the testing, soon you'll have to swipe your campus ID card in order to make it work. So don't forget to bring that along. Many faculty and students are looking forward to getting back to in-person teaching. And the anticipation is that by the fall, instruction will be predominantly in person. However, there'll still need to be some exceptions, and the Senate fully understands that the future will not look like the present or the past, and furthermore is not easy to predict. So I can assure you that the Senate is looking at short-term and long-term strategies for how to carry out our educational mission, whatever the new normal looks like, and looking at what policy exceptions might be needed in the future. With that, I'll hand it back to Bob. Thank you.
Thank you, Dr. Constable. Now I would like to introduce our first presenter, Dr. Natasha Martin, Associate Professor of Medicine and expert on epidemiological modeling. She's going to brief us on the state of the pandemic currently and the wastewater testing program in use here at UC San Diego. Natasha.
Thank you, AVC Consonetti. So Thank you. So I'm here to present some good news in terms of what's going on with the pandemic. So as you can see here, the green line here are the cases per day in the United States. So we are in a much better position today than we were just a few weeks ago, with daily new cases at about 80,000 cases a day, but rapidly declining from a peak of between sort of 200 to 250,000 new cases a day over the December-January period. So that good news is also being translated into reductions in hospitalizations, which is sort of making all the hospitals breathe a bit easier. And we're seeing these trends echoed also across the state of California, as well as within our own county. Next slide. So here on the left shows the cases by date of illness onset here in San Diego County. And so you can see again, we were peaking at between sort of around 3,000 new diagnosed cases a day and between 3,000 and 5,000 cases by the date of the illness onset over in that December period. And that has reduced to just under 1,000 cases per day and continuing to decline in the recent weeks. On the bottom right, you can see associated declines in terms of our hospital census for COVID. So a really steady decline of under 1,000 individuals currently hospitalized, and as well as declines in the ICU census, as you can see in the orange bars. The top right shows the triggers that the counties monitor in terms of different metrics in terms of this epidemiology, healthcare capacity, as well as public health response. What you can see is there's actually quite a lot of green check marks. We had been triggered in terms of our hospitalization and ICU capacity. We are no longer. And so we remain triggered in terms of our case rates, which are down from about 60 per 100,000 cases per day to now, as you can see, 22 per 100,000 cases a day and continuing to decline. So very good progress at the county level. Next slide. We remain concerned, though, in the context of emerging variants of concern. One of the variants that we're particularly interested in is the BU.1.1.7 variant, first identified in the UK. You can see now it's been identified in the majority of states across the United States and currently estimated to be at about 4 to 5% prevalence in California. And some modeling work that we've done anticipates that as this strain, which is estimated to be about 50% more transmissible than other strains, as it becomes the dominant variant, it could reverse the progress we've made in terms of declining case counts. So we're continuing to monitor this closely. Next slide, please. Two other variants that we're monitoring of concern are the B.1.351 mutation first identified in South Africa. Just last week, there were 2 individuals identified with this mutation in Northern California in the Bay Area. We haven't yet identified it here in San Diego, but we are concerned about it, especially because this particular variant appears to be associated with slightly reduced vaccine efficacy. Next slide. And the final variant that we're monitoring closely is the P1 variant that was first identified in Brazil. Only 2 states have identified this, but again, it's something that we continue to monitor. Next slide. Here on campus, the situation is good, as Dr. Constable mentioned. On the bottom left, you can see we're doing about 1,500 to 2,500 tests per day among our students, and on the right-hand side, about 600 to 800 tests per day among our campus employees. We have had only 4 campus employees positive in the past week, so really 0 or 1 cases a day among our campus employees. And among our students, which is here in the middle bar, we have gotten back to, as Chancellor Costa mentioned, to where we were last term, where we have been seeing only about 1 case per day among our on-campus students, as well as about 2 cases per day among our off-campus students. So in the last 7 days, only 6 students on campus and 18 students residing off campus diagnosed. And again, many of the students that are on campus cases were actually engaged in off-campus unmasked activities. So really doing a good job in terms of monitoring campus transmission. Our turnaround time is only about just under 17 hours in terms of tests to results. So very quick turnaround. Next slide. And finally, we continue to expand our wastewater monitoring program. We currently have 104 samplers, which cover about 300 buildings on campus. We're expanding that to about 150 samplers by the end of term. All this information is provided on our daily dashboard in terms of the status of the buildings, as well as an FAQ page, which has important information in terms of how to interpret those wastewater signals and what to do if a building that you work in or live in is positive. We have daily collection, except for our non-residential buildings. We do not collect on the weekends because there isn't enough flow. But otherwise, all this information is provided on the dashboard. And in consort with the reductions in cases that we've seen on campus, we've also seen a dramatic reduction in our wastewater positivity, as only 12 samplers were positive of the 104 that we were monitoring yesterday. So really encouraging results all around. And back to you, ABC Continetti.
Thank you, Dr. Martin. And I apologize again for the closed captioning. We're learning a little bit about North American history, it looks like, but it's a technical difficulty that we're struggling with. But now I would like to go ahead and introduce Dr. David Brenner, Vice Chancellor for Health Sciences. He's going to discuss vaccine distribution plans and other aspects of our efforts to control the pandemic here at UC San Diego. Dr. Brenner.
Thank you. Thank you so much. Next one, please. So I just want to add just a few fun things to what Natasha said. I would challenge, I see this little problem with the translation from Apple to whatever, but anyway, but I would like to challenge anyone to find another institution that's been more successful in figuring out how to do COVID-19 testing than UC San Diego. I think it really speaks to the combined strengths of our clinical care facilities, our educational facilities, and our research facilities. And the reason Natasha was able to give such a well-documented talk about our testing was we started first with the hospital's clinical labs, but that has a very limited capacity. We expanded it quickly, but still it was not able to meet the capacity required for UC San Diego and beyond. And because of that, we popped up a lab in a research building from scientists who are research scientists who figured out how to do very high throughput PCR testing for COVID-19. And that leads to these amazing numbers now. And the capacity is so large, we were able not only to fulfill our obligations to our UC San Diego campus, but also to our patients and staff, and then even beyond to other firefighters, schools, other places that did not have the access to very rapid turnover testing. So it really was a triumph. And some of you following the papers will see that our colleague Chip Schooley got an amazing write-up this week in the San Diego Union Tribune, and the previous speaker, Natasha Martin, was featured in the journal Science about how successful UC San Diego has been in these areas. I also want to emphasize the way people have used their research approaches to apply to this epidemiological problem. I mean, people who are not trained in this field have become experts in this to help our community. And you heard about some of this. The wastewater is not only being done, as Natasha told you, in UC San Diego, it's also being done in public school districts by us to help them to monitor. The vending machines were brought here. The every single type of test, the different from RT-LAMP to antigen testing, we've tested all these in our research labs to see what's the most effective means. And other technologies, as become available, will be assessed, and including follow-up people after they're vaccinated, looking for antigen re-exposure for re-exposure to COVID-19, as well as to the development of protective antibodies and other types of immune responses. So I just want to emphasize what amazing synergies have been between research, education, and patient care. The next part is a little more complicated. Next slide, please. I thought I was going to tell you everything about vaccinations, and it turned out that starting today, there's going to be a change. So let me just very quickly tell you where we are and then what I'm concerned about and where we're going. So as Pradeep mentioned, there's been a great collaboration between UC San Diego, UC San Diego Health, and the county to help with vaccinations. And the first superstation for vaccinations was set up here at Petco Park in collaboration with the Padres, and it's capable and is hitting 5,000 doses a day. Then REMAC was the superstation set up on our campus for our faculty, staff, and patients. So there were, up until today, there were two ways in which you can get vaccine. You can get it through the local health department, which would be the county, or you can get it through a managed care entity, which would be UC. The UCs combined so that we would get a separate allocation. Starting today, the proposal is to switch that to a third-party administrator, which would be Blue Shield of California, that would be responsible for distribution. And the formula for allocation is evolving. So we are going to, in the next couple of days, give you more information, but up until now, the productivity and the effectiveness of UC San Diego and collaboration with the county has been amazing. And one of the things that Pradeep mentioned is that we run out of vaccine every now and then because we distribute the vaccine as soon as we get it. We get vaccines in the people's arms as soon as we get it, which has not been true in different parts of the state. And in fact, the proposal now is if you do not distribute at least 77% of your vaccine, in other words, if it still seems to be in the freezers, you will not get a new allocation. And the reason why we occasionally have to stop distribution is because we've been very, very effective in getting the vaccine from receiving it from the manufacturer, from the county, to be able to distribute it. So we are actually doing very well by their criteria. But every now and then, as you probably know, we disappoint people and we say we're going to have to postpone your vaccination appointment because we've run out of vaccine. So this is changing even as we speak. And we will get back to you with additional information. But up until now, I've just been so impressed with the ability to vaccinate, and the data supports that. And I think even if they change the allocation, we will make sure that we're effectively vaccinating our community. So I'm going to stop there and turn it back over to Bob.
Thank you, Dr. Brenner, and again, Dr. Martin. The contributions of UC San Diego Health during this pandemic have been incredible to watch them evolve. Next, we're going to hear from Vice Chancellor for Student Affairs, Allison Satterland, and Executive Director for Housing, Dining, and Hospitality, Dr. Himlata Javeri, about plans for spring break, which is coming upon us soon.
Thank you so much, ABC Continetti. Dr. Javeri and I are delighted to be here and share an update with you related to our campus spring break plans. We have an exemption from our Emergency Operations Committee to pilot both an indoor and outdoor experience for our students for the spring break period, with the intention of limiting travel off campus during the spring break period. We know that the more our students are on campus with us and engaging in healthy activities and practices, the more likely we'll continue to see the limited spread of the virus and continue to ensure our students' health and well-being is at the forefront of our commitment to being a student-centered campus. So we've been working with 50+ individuals from all across campus to build out what we're referring to as tracks, sort of experience tracks. So an art track, a leadership track, a research track, an adventure track, a health and well-being track, a social justice track. The intention is to provide some of those experiences remotely, some of them a bit of hybrid, and some outdoor and in-person in groups of 3, masked and physically distanced. Again, our intention behind this is to create a fantastic spring break on-campus experience to limit the spread of the virus that we happen to see when we have a transition, whether it's from summer to fall, from fall to winter, winter break to the start of winter quarter. We'd love to have your partnership. You'll see my email address here. If you're interested in participating, we'd invite you, we'd be delighted to have you join us. That's vcsa@ucsd.edu. And all of this work is happening in partnership with Housing, Dining, and Hospitality. So Dr. Jabari, what would you like to add?
Thank you, VC Satterlin. The only thing I'll add is that in order to complement the robust programming that campus is coming together is food. Food is really important for our students, and we're making sure that students don't miss going to destination venues, that we bring the delicious menu to them. So you can see some of the examples that our culinary team is working on. And so really students are going to have a great week of delicious food on campus.
Bob, I would just add that spring break also serves for us as a pilot, to give us an experience with creating hybrid in-person remote events that will be relevant for summer as well as fall. So we appreciate the opportunity to share this plan with you, and again, invite our faculty and academic partners to join us in this endeavor.
Right. Thank you, Vice Chancellor Satterland and Dr. Jabari. Next, we're going to move to hear from Executive Vice Chancellor Simmons and Associate Vice Chancellor for Education Innovation, Carlos Jensen, about outdoor classrooms and updates on the current plans for winter and spring instruction.
So thanks very much. We're actually going to give a quick preview of future quarters in terms of the new academic equilibrium that we are all working towards. So next slide, please. You've probably noticed that about a month ago, UC President Michael Drake released an announcement saying that the UC would strive to be primarily in person in its fall instruction. He did that in consultation with the chancellors, and he wanted to get the information out to campuses as quickly as possible so that there would be time for each campus to make its local plans in coordination with local public health agencies. So going to the next slide. So as framing then for this effort, over the coming months, the faculty, the staff, the Senate, the administration, we will all be working together to make careful plans that are also flexible for fall. We will plan for the possibility of being nearly entirely in person, because the only way to get there is if we plan for that, but we will also build in the flexibility so that if the public health situation at the start of fall is not quite as great as we would like it to be, that we will have planned for how to pull back to have more remote teaching if that's what we need to do. So we will do whatever the current public health situation requires, but it's time to start planning for a transition back to predominantly in person, as the president has said. So the slide deck that we're sharing today outlines a general timetable as guidance, because of course all of the planning needs to be done in the individual academic units, coordinated by the deans in consultation with the Senate and so on. We have many months to do this planning, and we are getting a lot of great information about the public health situation every day, every week. So I think we have, we're well positioned to do this in a really positive way together. Next slide. So the following slides that ABC Jensen is going to go over with you show projections quarter by quarter of what we think we are going to try to plan for. Of course, operations in any given quarter are always subject to the prevailing public health guidance. Note that in fall 21, we do anticipate being able to achieve our longstanding plans of returning housing to design capacity, which is doubles only. We had temporarily, before the pandemic, had a housing shortage that caused us to use triples. Nobody liked that. We didn't like that. The students weren't comfortable with it. And we're happy to be able to go back to now design capacity, which will be doubles. Everybody living in campus housing, of course, will always have to follow the current set of health guidelines, whether that's masking, testing, whatever it might be at the time. So now let me turn this over to Carlos to go over some of the details with you. Carlos?
Thank you, Elizabeth. So next slide, please. So I won't spend a lot of time talking about the current situation. Just remind everyone that we are teaching and we are doing in-person teaching, just restricted to outdoors. As we look towards spring, and a lot of questions are coming in right now about what spring looks like, we are projecting and planning for a return to indoors instruction, as well as instruction in the outdoor classrooms. The conditions for spring will likely be very similar to what we experienced in the fall. We don't expect anything to dramatically change from that, but we will have to be adaptive as we see the current health situation evolving. I will note that this term, a joint Senate admin work group has started to take a look at distance education, academic resilience, and academic excellence and institutional resilience. It's a title that rolls right off the tongue. That's looking at kind of the recommendations and how we evolve as an institution to be more adaptive and to incorporate learnings from this crisis. And we hope that those recommendations or initial findings will be shared with campus by the end of spring term. Next term. So as we look towards summer, we're basically assuming that the rest of this academic year will follow the same rules that we've been trying to follow. So 25% occupancy, 6-foot distancing, enhanced sanitation, masking, etc. Last summer, we had a great experience with remote courses. A lot of our students chose to take a much higher course load over the summer, partly because of the situation and partly because the availability of courses. A lot of students travel home over the summer or are engaged in other activities. But being able to continue to advance their academic career was something that was very, very attractive. And we had a tremendous increase in students taking summer classes. So we're hoping to build on that success and model that. So classes for summer will predominantly be remote, we expect, but we will have in-person classes both indoors as well as in the outdoor classrooms, and especially for programs that are looking to kind of make up ground or catch students up on especially experiential and hands-on types of opportunities. We're going to be very cautious with non-course related events, and so we're going to limit that as much as possible. Part of this is a determination of whether this is a population that we have control over, because we want to be extremely cautious about who we bring on campus and our ability to enforce our current restrictions. And this brings us to fall of 21, when we are looking to be primarily in person. And I want to stress the word primarily. That does not mean an absolute number. That does not mean 100%. We're going to need some time to transition. We're predicting that we're probably going to have some students that are still displaced. There's a lot of talk right now about vaccination passports or travel restrictions based on vaccination status. We don't know yet what that's going to look like, but it's probably a safe bet to say that there will still be students who are unable to travel to return to campus. At the same time, we may have faculty and staff who are in a vulnerable population, or who may find themselves in a position where they're at that moment unable to safely return to campus. And as we have throughout this whole period, we will be adaptive, we will be compassionate, we will do the right thing. So what happens in fall is that the current dispensation from the distance learning policy that Senate has granted will expire. We're currently talking to Senate about a path forward, and you heard Dr. Constable mention that in the opening remarks. But the current R designation means something very, very specific. And so if you're looking for emergency solutions or planning for contingencies, understand that the R course is probably not going to be the right solution, but this is an ongoing conversation. We will seek or ask for a number of classes to be delivered remotely for fall, and that's to accommodate those displaced students. Over the fall term, we will also look to over time and as conditions allow, resume outdoor events or indoor events and start to return to the vibrant campus community and life that we all very dearly miss. And as was mentioned earlier, returning to double occupancy and design capacity for the dorms. Next slide. And then looking to winter, by fall, we hope everyone, we're planning for everyone who wants a vaccine to be able to get a vaccine. By winter, we're looking to achieve a new equilibrium, a new normal, a phrase that's been very overused in this difficult time, but primarily in person, primarily residential experience, but we know that there's been a lot of learning, there's been a lot of new tools that have been adopted, and so that new normal, that new equilibrium will probably look different. We'll all work together to define what that is. And then the other thing that I'll mention is the outdoor classrooms. We will maintain them. We will continue to operate them at least through winter term. Part of this to give faculty and students more flexibility and more options. And then we will evaluate come spring whether they're still needed and whether they're making an impact on the academic mission. So that's kind of a very high level overview of the planning for the next couple of terms. And as EVC Simmons mentioned, we will need to be responsive and adaptive to what actual health conditions are. Next. And I'll turn this over to EVC Simmons to talk through.
Thanks very much, Carlos. I just wanted to briefly let people know that back in the end of fall term, we discussed with the deans and chairs and provosts a planning exercise, anticipating that at some point we would need to think about how to move back towards in-person teaching. And this just shows some of the relevant slides, noting that we've now updated the third slide with the scenarios we asked to be considered. And if we go to the next slide, please. This just shows the point is that when we originally released the planning guidelines, we didn't have specific dates for when vaccine rollout might be happening or when we might anticipate moving back towards in-person instruction. The only change is now to insert the dates. And just reminding people these guidelines exist and they can help with the planning. And I think that's really our last slide. So if I'm not mistaken. So back over to you, Bob, and thanks for the chance to introduce this to folks.
Thank you, EVC Simmons and Dr. Jensen. It's great to hear about the careful steps being planned to return to the university life we all miss while being prepared to respond to conditions as they evolve. Next, it's not all about the pandemic. We want to hear about financial operations related to the Enterprise Software Systems Renewal Project. And we're going to be joined to do this by Controller and Assistant Vice Chancellor for Business and Financial Services, Cheryl Ross. Cheryl.
Thank you, Bob. And the pandemic impacts us all. So you will see in a couple ways that it's impacted this as well. But let me just kind of quickly go over the transition that we're in and how we're focused. And the most important thing to all of us and to all of you is the reporting and the tools that help you understand your operations. And so we continue to improve that. We've created new dashboards since the last town hall, including new dashboards we have that are going to be delivered by the end of this month, which is only a couple more weeks. And this is all providing help and assistance to the staff. We're also adding more resources to accelerate reports development. We've been very fortunate, I understand, and recently be able to get a couple more people from the outside again to help us with this report development. All the issues that we know about are published and available to look at so that anyone comes across something, they can click on it to see if it's already known, and if it's already known, is it being worked on? That information is knowable to all. We're refining our learning options to include more formal formal and structured instructor-led training. This is an area, and I'll mention it again at the end here, where COVID has impacted us in the inability to do in-person training, and the inability of the staff to learn from each other when they're in close proximity in their offices have really hampered the training, or I should say increase the training time that's needed. We continue to engage the community through new channels and existing change channels. That is, there's a change network, plus in forums like this and many others where we partner with the Senate. We partner with chairs, and any place where it's helpful to people to communicate, we're there. We're also have partnered with the Senate and OSI to launch a campus-wide survey to collect more feedback. And you should be getting an invitation to this later this month. We're also focusing on retaining and developing fund manager talent, because that's an issue of challenge in supporting the PIs. And we're looking at market equity, hiring, training, and career development for those individuals to enhance their ability to be successful and to enhance our ability to attract the right kind of talent. We've also established a faculty support fund to help mitigate impact resulting from system change. We will be meeting about that shortly. We have a committee that will develop criteria for which we can help faculties who were adversely impacted financially for the system change. So stay tuned on that. Next slide. I'm not going to go through all this, but I mentioned dashboards, and these reports are available. There's a link here that people can go to where more reports that you need are available now, and more are coming. And there's also an opportunity to request an enhancement. So let me just go on to the last slide here. So one of the things I want to mention too is that we have obviously lessons learned through this. We obviously faced an extraordinary situation where we were doing several large initiatives almost simultaneously. Some we had no choice about, and others, of course, we did and continue to review those decisions. One of the things that we've obviously learned that the PI grant reports or other reports needed to have more representatives from PIs and their fund managers in developing these, particularly with the combination of UC Path data, and that's so key to those reports. So that's where our two biggest systems come together, Oracle and PeopleSoft, in providing that, and there should have been more early on designing of that. The chart of accounts change, which we had to do, was necessary. All campuses will be doing it because we were making a system change. We had to do it now. This results in unknowns, say, lingering longer, but it will be helpful in the long run, but it's a little bit painful now. And finally, back to the point that I mentioned earlier, the lack of in-person training and physical access to peers to fill these knowledge gaps continues to be a major pain point, despite all of our attempts for virtual alternatives. I'm sure as educators, many of you see similar challenges, both in your teaching as well as in your collaboration with your colleagues or with your teams, that not being in person does have some challenges in quickly moving along the knowledge pathway. So those are my slides, and of course I'm going to be available to answer any questions that may come up in the panel. Thank you, Bob.
Thank you, ABC Ross. I know many faculty and our staff are interested in seeing how we can get through these additional challenges. And I'd also like to thank the rest of our presenters today. But now it is time to move on to the question and answer segment. So I would ask all of our panelists, including Vice Chancellor Matthews, Dean John Moore and Dean Jem Anthony to turn on their videos at this time. As before, during registration, we have received a number of questions, and we've selected some of the most popular ones for discussion today. And a number have been submitted as well during the Q&A. So we will address those that we have time for, and we will answer the best answers that we can give in the Return to Learn website after the town hall today. So, so the first question is a follow-on to the presentation, your presentation, EVC Simmons and ABC Jensen, and that is, will we be ready to open this fall?
I believe that we will, because if there's anything that we've seen through this pandemic, it's faculty and the staff here are tremendously capable and creative, and our students have been enormously flexible and understanding of the situation. So I think that whatever the situation in the fall turns out to be, we will be prepared to meet it. It may not look exactly the way we think it might right now, but we're going to do what's necessary, because that's what this campus does.
Thank you, EVC Simmons. There's a follow-up from the live Q&A, also to you, EVC Simmons, and that is there any possibility that faculty can host additional students in labs on campus this summer?
Okay. Yes, I'm glad that that's being asked. So at the moment, we still need to plan that we are structuring, having people work in labs through research ramp-up plans. And so if anybody wants to add additional students or others to work in their labs in the summer, they need to add them to their research ramp-up plans. Now, that being said, we're still in the purple tier. The county is still in the purple tier, which keeps us restricted as to lab occupancy and other things. But once the county is out of the purple tier, I believe that the Vice Chancellor for Research will probably bring forward a proposal to augment the occupancy of labs that is allowed. And that would then, if that is approved by campus, then that would give additional capacity for people to have more students work in their labs in the summer. So let's all stay tuned and see how that develops. But it's really very much on everybody's mind.
Thank you, EVC Simmons. Now we have a series of questions regarding vaccination for Vice Chancellor Brenner. And the first one of these is, do we have an update on the overall vaccine schedule?
So I was very confident about this until this morning, when I was told that there's going to be a change in the vaccine distribution. I tried to make that point very briefly, but we had a carve out until today where the University of California would get separate from the counties our own allocation, and we'd worked out an arrangement championed by the chancellors about how to distribute it between patients and faculty and staff. And I thought it was a very rational, well thought out way of doing this. And as of today, we don't know whether this will stand up, but assuming we get something like it, there's an equation. It's 2-to-1 where patients to UC San Diego faculty and staff will get vaccinated. The rules are always set though by the county and the state. In other words, we cannot interpret the rules differently. We cannot think we have more insight than the county. We have to be very strict or else we'll lose our allocation.
Thank you. A follow-on question is, could you say any more about how vaccine distribution will work for those who are both UCSD employees and patients of UCSD?
So this happens a lot. I mean, roughly a quarter or third of UC San Diego faculty and staff get their healthcare at UC San Diego Health. So what I tell people is, whoever offers it to you first, take it. I want everyone to get vaccinated as fast as possible. And sometimes they'll be notified because it's not clear who belongs to who. You'll get notified by different people. In other words, the county will notify you that they're ready for you, or you can book at Petco. If you get an early appointment at Petco, take it. If you get an appointment for REMAC before you get to Petco, take it. So I want our faculty and staff, to get vaccinated as efficiently as possible, to get as many vaccines in the arms as possible. Natasha probably has thought about this also. I don't know if she wants to add to this.
No, I think that was perfect. Just whatever opportunity you have, go and get vaccinated when it's available to you.
Thank you. Vice Chancellor Brenner, what is your best estimate for when students will get vaccinated?
So this is a kind of an ethical question. Right now, they are fairly far down the list. And the reason why is that the prioritization has been who is most at risk of COVID-19. The more you're at risk, the higher you're up on the list. So if you're exposed either as a healthcare worker or you have an underlying illness, you're higher up on the list. If you're a first-line responder, you're higher up on the list. But there was just an editorial today in the LA Times saying, wouldn't it make sense to vaccinate students so that they can get engaged back in the usual college activities? And that is a very good argument. It is not won the argument, but I can appreciate, that this is an ethical dilemma. And sometimes you might say, do I want to vaccinate a healthy 18-year-old when I have, a very vulnerable person with multiple underlying illnesses waiting for vaccination? But I mean, I would like to move students up, because I'm biased, because I live in an academic community, and I understand the enormous advantages of being able to interact. But unfortunately, right now, it will be a delay. And the logic is that students can get back to campus in a controlled environment with good testing even before they're vaccinated. That's the logic.
Okay, thank you. One more vaccine related question. People have heard a lot about the different vaccines and are wondering, can individuals choose the vaccine that they receive? And which vaccine will people get, say, from UC San Diego?
So it's done. The short answer is no, we're not allowed to choose. The longer answer is that the two vaccines are currently available, Moderna and Pfizer. The technology is almost identical. It's a novel mRNA technology in which the mRNA, which is used to translate the spike protein, is used by your own cells to make the protein, exposed in the muscle, leading to a local immune response, which then becomes systemic. So we cannot tell any difference between the two vaccines. The next vaccine coming up, the Janssen vaccine, is actually a completely different technology where it's incorporated into a modified cold virus, and it uses that DNA to then be translated to transcribe the RNA into DNA, into protein. And it only requires one shot. It does not require the same refrigeration. And they claim that because it's very easy to amplify these viruses, they can have 1 billion doses quickly. So currently the two vaccines are the same. We want everyone, if you get a Moderna for the first one, you should get it for the second one. Pfizer's first one, Pfizer for the second one. You don't get to choose. Petco is exclusively Moderna. Remap, we have both. And when we have the third vaccine, it'd be easier to distribute. But again, what Natasha said, I would emphasize that I want everyone to get whatever vaccines available as fast as possible. And the most important thing is to have a herd immunity than it is different types of vaccines. So this is where we stand right as of
Thank you.
today.
That's a very clear message. Get vaccinated as soon as possible. I'm going to move to a question for Vice Chancellor Satterlund. You mentioned spring break research experiences. So how would the funding for that work, and will it include students in off-campus housing?
All right, thank you for the thoughtful question. We do have one-time funds that have been directed specifically to support some kind of experience for undergraduates with research, whether that's a Zoom mentoring session with a dream researcher, in-person small group, 3 students and a faculty person utilizing our tents or our beautiful region. We've been working closely with the Return to Research Task Force in partnership with Miroslav and Faith and Jim. Last night, actually, we were on email working out a stipend per types of research experiences that might be made available as well as a budget for supplies, and in some cases, a request to share a pizza outdoors together. So we should have in a communication either Friday or Monday through the Return to Research Task Force, a very thoughtful, detailed budget allocation, stipends that'll be available for graduate students, for PhDs, for postdocs, for faculty, depending on what the opportunity will look like. And then in terms of off-campus student participation, we are really focused on our on-campus student community, and that's our graduate students who live in campus-operated housing, as well as our undergraduate colleges, but we are not going to exclude students from participating. So if there's an off-campus student who'd like to participate, please have them email me and we'll figure out a way to incorporate their participation.
Thank you, Vice Chancellor Satterland. Next question is for Dr. Martin. Why are we not requiring testing within 90 days of someone testing positive for the virus when there are many new strains and unknowns and variables with respect to COVID infection?
Thank you. That's a really good question. So of the several variants of concern, which we're monitoring, some of which I showed you earlier, the ones that were first identified in South Africa and Brazil have a specific mutation called E484K. And in laboratory studies, viruses with that mutation have shown reduced antibody-mediated neutralization. So essentially, it's a mutation which helps the virus evade the immune response. At the moment, we don't have any indication that those particular variants are present in San Diego, but when they become prevalent here, we've discussed this with our clinical colleagues, there may be a reassessment of the testing recommendations for those with recent past infection. So we will reassess that when we see those variants here.
Thank you, Dr. Martin. I've one more question for Vice Chancellor Brenner, and it's regarding how people should behave after they've been fully vaccinated. So after faculty have received the second dose of vaccine, should they continue to wear masks, fill out daily symptom screener, or let people know if they plan to come to campus?
That was the easiest question you ever asked me. So the answer is yes to all those. There's still a risk of spread. There's still a risk of getting infected, and so we really have to behave. And if we do, it'll make an enormous difference. And one really little fact that I thought was amazing was how low the flu incidence has been this year, and people are attributing it to the fact how well we're behaving, with all the public health discipline, and that's made an enormous difference in normal flu. Natasha's probably thought a lot about this. Maybe I can ask her.
Yeah, I mean, one thing that I would note is that, we are concerned with these new variants and some of them which are more transmissible. And so in order to reduce the risk that we have any transmission of variants and any emergence of new variants, we really need to ensure that everybody continues to mask, socially distance, do your symptom screening, and kind of all those things which we know work, especially in light of that, in the context of that.
Thank you. And actually, one more question for Vice Chancellor Brenner. I mean, a lot of people in our community have had COVID now, and so people are wondering how long post-infection should those who've already had COVID wait to be vaccinated?
Yeah, the recommendation is 90 days. That they think that will lead to a good immune response. So people, after they're exposed, after they've had COVID-19, they wait 90 days and then get vaccinated. And the theory is that the vaccination, because it's the way it's presented, can be more effective as creating long-term immunity than having the actual infection.
And Vice Chancellor Brenner, you described how even today the process for distributing vaccine has undergone an evolution. But one question that was related to that is that are staff and faculty still eligible for vaccine through UCSD if they are not in the UCSD health system? I mean, before today, that was certainly a yes, but maybe now it's evolved.
I certainly hope it's still a yes. We really are committed to doing this, and so we're going to work out over the next couple of days how this change with the with this TPA, that Blue Shield will be distributing it as an intermediate. So we'll work that out very quickly. But I really felt the way we were doing it was very effective, and the entire community was benefiting by the health system, being actively engaged with the county, and with our community. So I hope we get to continue that, because I was really very, very impressed.
All right. Well, thank you again for that, Vice Chancellor Brenner. I'm afraid that is all the time we have for today's town hall. I want to thank everybody for their questions. We're going to, as I mentioned before, attempting to answer everyone's questions by updating the FAQ that is on the Return to Learn website. And we will also be posting a recording of this town hall. The next Return to Learn faculty town hall is scheduled for March 9th, and look forward to seeing you then. Please go to returntolearn.ucsd.edu to register. Again, I'd like to thank the presenters and guests for sharing their time and information with us today. And I really want to thank you, the faculty of UC San Diego, for attending today and for continuing to work together as a community to help bring us through these unprecedented times. And please fill out the post-event survey that will be sent shortly to help us continue to improve our means of communication during these stressful times. So thank you and stay safe.